Again, welcome everyone that has joined us. We'll get started in just a couple minutes. If everyone could please mute themselves during the presentation, then there'll be time for questions and things later on, but we are glad you're all here and we'll get started in just a couple minutes. Okay, it's 12 o'clock, so let's get started. Welcome everyone to the League of Women Voters Timely Topics. Thank you all for being here. It's nice to see some faces, some familiar faces on the screens. I just want to welcome today's timely topic is intersection of race, stress, and health. And I will let Retta introduce the speakers in just a minute. But before we get started, kind of the same routine, you know, the Zoom technicalities, we ask that everyone except for the presenters should mute themselves during the program. And if you could turn off your video when the presentation begins, although on this time around, I think that our guest speakers have a couple times where there will be polls and maybe be asking the audience a question. So if you want to turn your cameras on during that time, that's great. And we'll let the presenters, they'll let you know when the questions are coming, or if they want to see you, they can give you those directions. Also, use the chat feature for questions, as we have been doing for the last 2 years. Just type, if you can type question or a big capital Q in the chat box before you write your question, that will alert us to know that it's a question and not a comment. And we will be asking those questions at the end during the Q&A portion of the program. And just some upcoming events. If you live in Cary or close to Cary or interested in the Cary municipal elections, League of Women Voters of Wake County is hosting a candidate forum tonight with 10 candidates. And that will be at Christ the King Lutheran Church from 7 to 9 p.m. tonight. We have some great co-sponsors that will be there as well. And that will be recorded and be made available later if you can't make it and are interested. Also, tomorrow we have more guest speakers. It's a busy month at the League. The Affordable Housing Committee have asked guest speakers, Wake County Commissioners Vicki Adamson and Matt Calabria, to come and speak about Wake County affordable housing initiatives that they're working on. So that should be a great meeting, and we hope that you all attend. You can register on lwvwake.org on the calendar or under events. And very important, the annual meeting. We would love to see all of our members attend our upcoming annual meeting on May 19th. You should have all received an email from me this week with a notice of the annual meeting. It will be at the NC State University Club. So we're going to be in person, yay, so we can see each other again. It is a dinner. The cost is being subsidized by the League. So we hope that you will take advantage of the opportunity to meet and see what is coming up this year at our annual meeting, look at the budget, approve the budget, and that is 6 to 8 p.m. on the 19th. And that is all I have. And at this point, I would introduce Retta Rorden, our board member and co-chair of the Healthcare Committee, and she will introduce our guest speakers. Thank you.
Thank you so much, Cheryl. I'd like to welcome everybody. I'm very excited about today's presentation on the intersection of race, stress, and health. I've read a lot about race and health, but I have never heard with the extra added component of stress. And so I hope you find this as interesting as I have in chatting with our speakers. Before we get started, I just want to say a few quick words about the League's Healthcare Committee. The committee chose to focus its first major initiative on Medicaid expansion with 5 summary sheets on the topic. The summaries range from an overview of what Medicaid expansion is to how it's funded. I'm extremely proud of the work the committee has done on this project, and it is on the healthcare tab on the LWV Wake website. And so feel free to explore the tab. We are fortunate to have 2 very knowledgeable and accomplished speakers with us today. Regina Pettaway has a Master's of Science in Public Health. She retired last year as Wake County's Human Services Director, where she was responsible for public health and social services leadership in a department of 1,600 employees in 17 locations across the county. During her tenure, the Medicaid processing rate improved from about 60% to 98%. And she also worked on major improvements to public health clinic service delivery. She developed many lasting partnerships across the county, focusing on improving the health and wellness of people in the community. She has over 47 years of experience at private, nonprofit, and local and state government levels. Michelle Laws, PhD, is the Chief Experience Officer for the North Carolina Medical Society, where she leads the group's communications and member services teams. In March of 2020, she joined the HHS COVID-19 emergency response team to help lead the historically marginalized populations work group. And by the way, that phrase HMP will be used throughout the presentation. It was a new one to me. In this role, she helped guide the department's work in improving health outcomes for historically marginalized populations during the pandemic. Previously, she held leadership positions in various state and nonprofit agencies. And with that, I'm going to turn over the virtual podium to Regina Pettaway. And I'm going to share my screen, so just give me a second here. Regina, go ahead.
Thank you. Good afternoon, everybody, and thank you for the opportunity to be with you today. I am also now a member of the League and happy to be a member. So we're actually going to start this with a pre-presentation survey question. If you would go back one slide, please. So here is our poll. Our question is, how comfortable are you talking about race, stress, and health? How comfortable are you talking about how they are related? Not at all, you know a little, you know enough to talk about it, or you're very comfortable discussing the topic. So we'll give you a minute to answer that question. And don't think too much about it. Just give us your gut reaction. And we're going to ask you that same question at the end of the presentation, hoping you have moved a little bit in what you know and how you feel. Okay, so it looks like about 5%, 1 person out of 21 is not comfortable at all. 13 people know a little about the topic, 3 know enough to talk about it, and 4 are very comfortable. So that's where we are starting our presentation. Thank you for that poll. We can end the poll now. And once we stop sharing the poll, I'll move forward. Okay, so let's talk about the intersection of race, stress, and health. Yes, we'll start with this slide. Thank you. So first of all, I want you to know that my job is really to ease us into this topic and to prepare us for very specific statistics and information that Dr. Laws will be presenting. I wanted to start out with a couple of thoughts. One is that women of color come from a legacy of proud, strong women, and we are expected to hold it together at all times, at home, at work, wherever we are. Now, I know you say, okay, Regina, it's not just Black women and brown women that have to do that. But when you hear Michelle talk, you will see how it's different for us. Now, the result, one of the results of having to be strong all the time is that Black and brown women are disproportionately suffering from physical and mental health issues. Next slide, please. So here are just 3 examples of health disparities related to race. And again, Dr. Laws will go into some very specific statistics around disparities. We know that Black moms and Black babies die more than white moms and white babies. And North Carolina and Wake County have been working very hard on these disparities. And we were making some progress. But as you know, we are in a pandemic. And with the pandemic, the disparities are growing again. African Americans have a higher rate of heart disease, cancer, and diabetes. And Blacks are also hospitalized at a higher rate from COVID. Next slide, please. Next slide, please. Thank you. Now, one of the concepts that I wanted to bring to you is about place and how place matters. So this is a slide from the Centers for Disease Control that shows life expectancy by census tract. So don't worry if you don't know your census tract number. Just generally think about on this map where you live. And just know that the red color means the lowest life expectancy, 56 to 75 years. The pink color is 75 to 77. The light blue, which looks white to me, is 77 to 79. Then light blue is 79 to 81. And the highest life expectancy is dark blue, 81 to 97 years. And these are averages and life expectancy at birth. So let me ask you a question. In general, what is the life expectancy where you live compared to other parts of Wake County? So if someone is brave enough to come off mute and tell us, in general, where do you live on this map and how do you see that being different than other places in the county?
Hi, this is Diana Wynn. Can you hear me?
Just barely.
Well, let me see if I can speak a little louder. I think I live in a dark blue zone, so 81 to 97% at the western part of the county, and that's a stark difference compared to the eastern part of the county.
Absolutely. And why do you think that is? Stay with us.
One of my guesses would be socioeconomic factors between those districts that I see. But I would also suggest when I look at the pink and the red, it's also race.
Absolutely. Thank you. And thank you for being brave enough to share with us. So it's both of those things. And it's what comes with racial disparities and economic disparities. So, think about the western side of our county. How many grocery stores do you have within a square mile? How many sidewalks do you have? What do you have access to in the western part and some other parts of our county that people who live in these red zones may not have access to? So that's just something for you to think about. And Dr. Laws will go into more depth about not only why place matters, but what else matters when it comes to race and stress. Because some of the things that you've talked about, the economic stressors, racial stressors, environmental stressors, they all add up. Next slide, please. Now I want you to look at our state. So you thought there were some red spots in Wake County. Look at the rest of our state. What you see here is that there's a difference in place based on even what county you live in. So I don't know who knows all 100 counties, but can somebody come off mute and tell me where you see a county that's entirely blue?
Yeah.
Yes. I see someone trying to answer. If you would come off mute, please. So while we're waiting, you can see that Wake County doesn't look so bad when you compare it to the rest of the state. And you can see especially some of the southern counties, they are mostly red. I think one of the other patterns that you may be able to see is that where you have urban areas, or for example, on the coast, there are areas with higher tourism and higher income, you see more blue. So this is another example of how place matters and how race matters and how economics matters. And Dr. Laws is going to help us understand how all of that is related to stress. Next slide, please. And I think this is my segue into turning this over to Dr. Laws.
Wow. Thank you, Regina. And I first of all want to thank the Wake County League of Women Voters for this opportunity to share with you today and to participate in your time topics. I want to thank Cheryl, and I want to thank Retta and Regina for the invitation. I will go right to the next slide, which is my beginning slide, and I'm hearing some feedback, so I thank you. So if you will go to the next slide for me, Retta, that would be great, and we'll just jump right in. Regina really laid a good foundation in terms of several factors that contribute to health outcomes, good or bad. I often start with this slide in any presentation that I do. The picture there is one that captured my attention years ago. It was taken by a Times photographer following or in the aftermath of Katrina back in 2005. And that is the picture at that time of a woman, Melbertha Hendricks, who at the time was 85 years old, back in 2005. The photographer captured her sitting wrapped in an American flag, as you can see, outside of the New Orleans Ernest Morial Convention Center while she was waiting for survivors to be evacuated. I used this picture to start the conversation about health equity from whatever perspective that I'm asked to do so. And in this instance, it's looking at the intersection of race and ethnicity, stress, and health. But I start here because this picture represents the fact that in the United States and in North Carolina, there are several key variables that will determine your health outcome and how well you can recover from a pandemic, a natural disaster, or even a personal crisis. And those factors are who you are, your race and ethnicity, your socioeconomic status and your gender, and even the intersections of those, where you live, so the geography. So as Regina mentioned, zip code matters. So not just the county that you live in, but the zip code that you live in within that county, your age, and also access to several key pieces of capital that I say are extremely important. Social capital, right? Who's in your social network? So for example, social capital is important. Let's just use the school closings during the pandemic, the shift to virtual learning. If you lived in a community where there were stay-at-home moms who were available to help tutor or help students who had to learn virtually go online, and while you went away to work, that's a form of capital that can yield positive results or gains. But think about women and families that do not have access to certain social capital within their social network. Maybe they live in a community where everybody works. And so the burden of having to become an educator, basically, or assistant teacher, I say, most parents became teachers' assistants during the pandemic. The outcome looks very different. Economic capital is clear. If you can buy health insurance, if you can also afford top quality treatment, when we think about substance use treatment, for example, if you can afford to send a loved one or you yourself go to a facility, a residential treatment facility that only accepts private dollars that have shown to be effective versus being on a waiting list to wait to get access to public services, the outcome is very different, right? And even your political capital. Some people have the benefit and the privilege of having in their phone as primary contacts or in their LinkedIn profile as level 1 contacts, people who have access to political capital or elected officials themselves. So it makes a difference if you can say, hey, you know what? Our water needs to be tested in our community because people are getting sick or children are getting sick. So I'm going to pick up the phone and call the governor, or I'm going to pick up the phone and call the secretary of DHHS, versus living in, say, for example, McDougal Terrace in Durham, where it made national news about people who were living in housing that had carbon monoxide and not having access or being in close access. So I say all of this for you to keep this in mind as we travel through this presentation. Next slide, please. I also want to couch it within the context of COVID. So the next slide. So I want to also talk about a little bit before we talk specifically about stress effects and health. And I want to talk about it within the context of this COVID-19 pandemic. So we do know that the impact of COVID was not equal across demographic groups. We know that Blacks, Hispanics, American Indians in our state, poor or people living in poverty, and rural populations were hit the hardest. And we also know that there were certain disparities across mortality and morbidity variables or matrices. So if you'll go to the next slide, for example, we know that early in the pandemic, we saw disparities, and the next slide will show disparities across ethnic race and ethnic groups in terms of the cases, COVID cases, also in terms of hospitalizations and deaths. So early in the pandemic, African Americans, for example, if you look at this graph here, African Americans were about 2.8, almost 3 times more likely to die compared to whites in the pandemic. And we saw similar disparities across other demographic groups or race and ethnic groups. So for example, Hispanic and Latinx, about 2.8, the same, as well as American Indians, about 2.6. So if you'll go to the next slide. When we look now, where we are now, we still see disparities in terms of hospitalizations, cases, and deaths. So key metrics in terms of assessing the impact and the cost of COVID-19. And when we look across demographic groups, we still see these disparities existing, although the gap has narrowed somewhat, right? And so now we see, in addition, and a lot of this is due to the Omicron variant, where we saw the deaths of whites also begin to climb exponentially. And so we didn't see that wide gap in terms of deaths once the, disparities in terms of deaths once we began to move into the fourth quarter of the Omicron variant. But the disparities remained, and we'll talk about why that is so in a moment. So the next slide. So coming in again early in the pandemic in North Carolina, we saw disparities across race and ethnic groups in terms of cases in North Carolina. This is what the data looked like in North Carolina coming into the pandemic, where Blacks, next slide, and Hispanics, as well as American Indians, were hardest hit in terms of deaths and cases. African Americans in particular, all the way through to the end of 2020, mid-2021, were shouldered a disproportionate burden of deaths. So next slide, please, in North Carolina specifically. And this is just an example illustrating that, looking at the data in North Carolina and seeing where there had been, I don't want to indicate or leave the impression that historically marginalized populations were the only ones to suffer. But if you look at, and if you follow the trends based on race and ethnicity, you will see that a disproportionate burden of death and disease, mortality and morbidity caused by COVID was shouldered by our ethnic minority populations. So next slide. And these slides simply illustrate that by cases as well as deaths. And looking at where we are now, there has been again a decrease in the gap between Blacks, Hispanic, Latino or Latinx, American Indians, and our white population in North Carolina. Next slide. And so when we think about COVID's impact in terms of mortality and morbidity, hospitalizations, the evidence is clear. African Americans, Hispanic and Latinx, and American Indians have suffered throughout this pandemic. One might ask, well, why is that the case? One explanation is that coming into the pandemic, people of color, BIPOC, or historically marginalized populations came into the pandemic, shouldering a disproportionate share of health, chronic health conditions and disease disparities. And so this simply shows us that looking at this graph here, it shows us when we look at over time, going back to 2010, all the way to 2019, prior to the pandemic, you'll see the disparities that existed in terms of longstanding disparities in not health, but ability to respond to your health by what means? Health insurance coverage. So this graph shows that, okay, people are sicker, right? African Americans, Latinx, Hispanic, American Indians came into the pandemic sicker. But if you look at this graph, not only were they sicker, but they also were less likely to have health insurance coverage to respond to their medical needs. And this is an important point for us to highlight. And I'm so glad to hear that the Wake County League of Women Voters has identified Medicaid expansion as crucial, because if you will see, or as this graph points out, over time, starting from 2010 all the way through prior to the pandemic, 2019 data, the gap in terms of insurance coverage or health coverage has been constant, certainly restricting at times or getting smaller at times, but has been constant. There has been a gap when you look across demographic groups, and that's important. Next slide. And this is the point I made prior to talking about this, the health coverage. So I got ahead of myself, but this was the point I was making in terms of when we think about COVID and its impact. COVID is now the third leading cause of death, or was the third leading cause of death. And when you think about health disparities, heart disease, cancer, and COVID-19, which populations do you think are most likely to suffer or to die from these chronic health conditions? Those that I mentioned: African Americans, Hispanic and Latinx, and American Indian populations. So this looks at the general population. However, if you disaggregate the data, what you will find is, in terms of heart disease, in terms of some cancers, not all, and in terms of COVID-19 and unintentional injuries, you will find a disparity across race and ethnic groups, with African Americans in particular shouldering a disproportionate shoulder or a share or proportion of the chronic health conditions and mortality and morbidity across these conditions and diseases. So diabetes, for example, stroke, for example, certain forms of cancer and heart disease. So next slide. So I'm moving us into why it's important for us to look at stress and its effect. One, it's important to know, and I just want to have this disclaimer, that the COVID pandemic did not create health disparities. It simply illuminated the fault lines of what I call structural inequality across systems, right? So historically marginalized populations, those that I mentioned, coming in again to the pandemic, came in with pre-existing health disparities. They also, and when we think about each of those populations, and I'll just highlight African Americans in particular, because that's where I've done most of my research and also my lived experience. So when we think about what I call historical medical traumas, Tuskegee was not the only one, right? And for those of you who want to sort of get a really good idea and learn more about historical medical traumas, I recommend a book by the title of Medical Apartheid for you to read through, and you will see this long history dating back to slavery and even before slavery, but dating back to slavery all the way to contemporary time period where Blacks have suffered in terms of the medical and clinical, from that perspective, historical medical traumas. So they came into this pandemic already with these historic and persistent structural inequalities and health disparities. But not only that, historically marginalized populations were also overrepresented as frontline workers, low-wage workers, workers that did not have the luxury of working at home. And then also social determinants and structural racism and inequity. So next slide. For example, when we talk about the next slide, please. When we talk about the exposure and risk for exposure to COVID, coming into the pandemic, the Blacks and Hispanic populations were less likely, as the next slide will show, were less likely to be able to work from home. They could not do like many people with high SES were able to do, and that was to work remotely. They still worked in fields and in positions that required them to interact or have high exposure and engagement with the public, thereby increasing their risk for exposure to COVID at a time when many things had shut down, yes. But what didn't shut down? Grocery stores. What didn't shut down? Fast food, right? You may not have been able to go into the seating area, but the window, right? The drive-through stayed open. What didn't shut down? What did you still need? You still needed housekeepers and to work in facilities, like, for example, in hospitals, you still needed housekeepers. You still needed food service delivery people. And many of those persons were persons of color or historically marginalized populations. And not only that, next slide, please, many of them were, guess who? Women. So we know about half of all workers, about 1/2 of all workers are women, but nearly 2/3 of women are frontline workers, or frontline workers are women. And women are particularly overrepresented in the frontline industries such as healthcare, and in particularly among low-wage positions. And so those that I mentioned, your housekeepers in your hospitals or healthcare facilities, your food service workers, CNAs, and so forth. And also in the childcare and social services industries. Next slide. Women were also represented across a variety of frontline or diversity of frontline industries that many people don't think about, but that oftentimes when we look at these positions comparatively, again, places women in mid to low wage positions. So not as pharmacists, but pharmacy technicians, right? Assisting. Customer service representatives. And as I mentioned, fast food. Next slide. And I know you're saying, what does this have to do with stress? I promise you I'm going to make that correlation. This is just another way of looking at the occupations that have where many women of color work. And if you see, look across these particular industries, these are industries, again, that place them at high risk for coming in contact with the public during this pandemic. But also these are high stress environments that people are working in, right? And so when we think about women, one, just in general, who are working in these populations, and this slide shows us women of color, but that are working in these particular jobs or workforce industries, you'll find that many women of color are working in high risk positions or jobs that are also high stress jobs because of the level, one, of contact that they have with the public, and also tie that to low wages and tie that to the type of environment and exposures to, for example, manicurists and pedicurists, toxins and so forth. Next slide. So as we move into the stress piece, so not only do we find women of color in high stress positions, low wage positions that contribute to stressors, we also find women and women of color in particularly shouldering, again, a disproportionate burden as it relates to social drivers of health. Disparities don't just happen, but there are things that lead to health outcomes that we refer to as social determinants or social drivers. So employment, as I mentioned, right? And not only employment, but working hard and hardly making it, living paycheck to paycheck. And there's a book that I read years ago that talked about the high cost of being poor, right? That poor are more likely to obtain goods and services with high rates of, that they have to pay on the return. I've just lost that word there, but interest rates, with high interest rates. They're also more likely to have to pay higher rents or invest in housing. Affordability is out of reach, so they oftentimes are forced to pay, for example, going into a home, if they have low credit ratings, or because they paid high interest, or because they just haven't been able to maintain a good credit score, keeping their bills paid on time, paying off debt in a timely manner, and so forth. They're also more likely to pay more in rent and also to obtain housing. So it's a burden, it's a high cost. Also environmental issues, right, are social determinants or drivers of health outcomes and health disparities. Transportation, where people live, the environment that they live in, education, food insecurity, community safety, and access to healthcare, and not just healthcare, but access to quality healthcare, healthcare that is culturally and linguistically appropriate. And now we've got to add and talk about trauma-informed care, especially given the traumatic lived experiences that many people of color face. Next slide. Coming in, out of, and through the pandemic, for example, if we look at the social determinant housing or social driver, we know, and this is a picture of a Raleigh family being evicted. And what's so interesting about this picture to me, and sad, is that this little girl is playing on the sidewalk while the family is being evicted. And so she's oblivious to the impact that this is having. But can you imagine the mom or the guardian or the family member and the inordinate amount of stress that comes along with, one, not only am I being evicted as a single person, that's a different level of stress, right? But I'm being evicted and I've got children or a child to take care of. Stressor, housing, stressor, whether it's inability to keep up and pay the rent on time and have your credit, intact or impacted, or the risk of eviction always looming overhead, and or eviction happening. And there are some families that are in this perpetual cycle of poverty or of barely being able to make it, that stays in this perpetual cycle of high stress and distress because they are barely making it and meeting their essential needs, housing or food and shelter. Unemployment, when we look at unemployment, we know that that was the right slide. Thank you. You turn it. When we look at unemployment, right, it's critical. How can you keep a roof over you and your family's head if you don't have an income, right? And you have many families that are working 2 and 3 jobs, and the housing markets in the triangle, right, seem out of reach, right? The high cost to rent, even, let alone own your own home, for many is a burden or stressor that affects their health. Unemployment, the unemployment rate coming into the pandemic didn't create this gap in terms of unemployment by race, but we certainly saw clearly the impact, the disparate impact for those who were unemployed. What am I saying? What are you saying, Dr. Laws? Many families, white families, families that were tied to affluence or tied to family members that had money in reserve, even Black families that had money in reserves, the unemployment pinch was just that. It was a pinch, right? It was an inconvenience. It was a stressor, but then there were those who faced chronic unemployment, who were already working in jobs, low wage positions, and it was more than just a pinch. It was a slug over the head or in the chest. Next slide, please. So social determinants are extremely important, and for the sake of time, I'll rush through this, but a household pulse survey that was done in 2021, late 2021, September, looking at just a snapshot of time, Nearly 7 in 10 of Black and Hispanic adults, 66.4% and 69.2% respectively, reported difficulty paying for household expenditures compared to 43.6% of whites. And 14.9% of Black adults and 14.2% of Hispanic adults reported food insufficiency compared to 6.3% of white adults. Furthermore, around a quarter of Black and Hispanic adults reported living in a household that experienced a loss of employment income in the last 4 weeks at the time that the survey was done, compared to 13.1% of whites. Next slide, please. A stressor. Also during this pandemic, a lot of people forget the fact that George Floyd was killed on May the 25th, 2020. When did the governor in North Carolina declare a state of emergency in terms of the COVID pandemic? In March of 2020. Breonna Taylor, although the protests ramped up around June, Breonna Taylor was killed on March the 13th, 2020. The slide I showed you before, early on, about the deaths who were more likely to die from COVID early on in the pandemic were Blacks. Combine that with watching at the same time, you're seeing and hearing, at the time, it was Secretary Mandy Cohen and the governor come on TV every week, every day, and report on the status of the COVID pandemic in North Carolina. And you are hearing Blacks are dying, or you're seeing, you go to DHHS's website and you see the data that is showing that Blacks are dying at an alarmingly higher rate than any other race or ethnic group in North Carolina as a result of the COVID pandemic. Add that to the fact, and American Indians were feeling the same or seeing the same. Add that to the fact that nationally now, taking over the COVID story is the George Floyd story. Imagine being a mom, an auntie, a grandmother of a Black male during that time. On the one hand, you're worrying about your public health safety of your family. And on the other hand, you've got an additional stressor, the potential that your child, your daughter, like a Breonna Taylor, could be in their home, or your son, like a George Floyd, or your brother, or your niece, or your, right? So just imagine that. And while everyone was horrified, most people were horrified about what happened to George Floyd and Breonna Taylor, can you imagine the additional compounding effects of that horror, that distress on Black and brown families? Next slide. Oh, before we go, and this is across SES, the lady there with the breathing tube is a doctor, Dr. Moore, who chronicled her experience on a COVID ward, talking about, she's an MD, was an MD, a physician, about the maltreatment, the poor treatment that she was getting, and stated that if I die, it is because of racism. They are not treating me, one, like I'm human and like I know what I'm talking about, and I am a physician. They want to send me home, and I know I am not well. So she chronicled this in a video diary. She died, and her son released the video diary. She died. And she died talking about the different ways that Blacks were treated across SES. And one of the things she pointed out, I'm a physician, and if they're treating me this way. So stressors, stress being able to afford healthcare, stress being able to access healthcare, and then the stressors dealing with the healthcare once you have it, the treatment that some people, and not all, I work for an organization, the North Carolina Medical Society, that represents North Carolina's physicians and physicians assistants. And I can tell you that the majority of our physicians and physicians assistants are good people and take the Hippocratic oath to do no harm, seriously. But there are those experiences where the healthcare system in and of itself has worked in a negative way against African Americans and other minorities. And I will drop the link in once I'm done with the presentation. You can just Google doctor dies from COVID, claims racism, or Dr. Moore was her name, and it'll, all kinds of things will pop up, including links to her video diary that CNN actually showed and shared. And that's how I found out about it and did my research. Next slide. So historically marginalized populations in the collective have a history of trauma that is chronic and complex. Trauma affects health-seeking behavior and responses to health services. Dr. Averitt Moon Parker, I had the privilege of sitting at a Black Caucus Brain Trust years ago in the 90s in DC, and she said something that was so profound and it stayed with me, and I share this in my presentations on stress. Dr. Averitt Moon Parker stated that the Black community in the collective doesn't suffer from post-traumatic stress disorder. They suffer from daily ongoing traumatic stressors, and reminded me of something my grandmother used to say all the time. She would say, if it ain't one thing, it's another. And that's the lived experience of many historically marginalized populations, whether they're African Americans, Latino or Latinx or Hispanic, or American Indian populations. And I'm purposefully referring to them as American Indian in our state. That is what they have been asked to be called, and not indigenous, the older ones anyway. Next slide, please. So where does stress come in at? One, you have to look at all of the socioeconomic risk factors that are also stressors. These are also, there's research on all of these and the impact, the mental and psychological impact. So sex work, human trafficking, the experiences that comes with being, quote, undocumented, right? 2 out of every 3 women are caregivers. And I already talked about being frontline essential workers. Many African American homes are led by single heads of households. Most of them are women. North Carolina, and we just coming out of Black Women Mortality Week, focusing on the fact that African American women have the highest level of maternal mortality than any other group in the country. And there are some data that shows that we're higher even in other countries less developed than ours. North Carolina has the 11th highest infant mortality rate in the country at a rate of 7.2 births per thousand. And if you'll go to the next slide, when we look at the maternal mortality rate by race, again, the point that I made about African Americans, non-Hispanic Blacks having the highest than any other race or ethnic group in the country of maternal mortality. So next slide. So as I tie this in, I want to first say that race is not a factor for illness and death, but racism, bias, and discrimination definitely are. There is no known genetic connection between skin color or melanin concentration and biological causes of maternal illnesses or any other chronic illness. And I have to attribute this, and I always say it verbatimly because it says it so clearly. I have to attribute this, though, to Claire Perry, who is the founder and president of the National Birth Equity Collaborative, which is an organization that advocates for better Black maternal and infant health. There is no genetic link. There's no genetic tie. Now, I do work around epigenetics that looks at the impact of the environment on gene expression. That is a real thing. But to draw a genetic link to these health disparities, and particularly in this instance, for this quote, maternal health, but it's true of other illnesses, chronic health conditions is not supported by science. So the stress effect, let's go in and I will wrap this up, tying this to stress. The stress effect, next slide, please. When you look at stress across populations, it's important to know that stress is not unique. I want to be very clear. Stress is not unique to any one particular race or ethnic group. And so I start this out by sharing this, that this was a survey that was done by the American Psychological Association. And it found that among all of the different economic stressors, those that merged at the top were largely money, economy, and housing. And if you look at that, Latino adults, in terms of money, for example, were more likely to report that money was a stressor, followed by Blacks, followed by whites, and then Asian adults. When you look at the economy altogether, again, Latino, Latinx, followed by Blacks, and whites, followed by, and then again, of course, housing. When you think about housing, African Americans, followed by white adults, followed by Latino, and then Asian populations. Next slide, please. Stress is not unique. There are multiple stressors that affect all populations and communities. And so the next slide shows us here that when we think about across the lifespan, Gen Xers are most likely to report that they are stressed, and this is according to the American Psychological Survey that was done. Health-related concerns, followed by work and money, followed by family responsibilities. Next slide, please. And then, next slide. And then the millennials, money, health-related work. Next slide, please. Gen Xers, the economy, health-related, money. Does anybody see a trend here? No matter where you are, what is popping up? You can drop it in the chat. Health-related among boomers, the economy, and work. Different order, right? Next slide. So the boomers is in. So what did you see? Different orders, but that was certainly showing up in the top. Health-related concerns. And when we think about it and we look across the spectrum and of demographic groups, and next slide, and when we talk about anxiety and depression and stress, and that's older adults, that goes on. Next slide, I'm sorry, I was ahead of, I'm looking at them on my screen. Next slide. So when we look at it across demographic groups in terms of anxiety and depression caused by, going again, housing, work, health-related conditions, and illnesses, with health-related always in the top 3, no matter what age you are and no matter what your race and ethnic group. Isn't that interesting, right? Okay, so when we look at it in terms of in the aggregate by race and ethnicity, we find that other than non-Hispanic, other non-Hispanic, so that could be mixed, that could be they just chose other or what have you. But non-Hispanic Blacks are more likely to report, followed by Hispanic or Latinos, high levels of anxiety and depression. And this was during the COVID pandemic. Next slide. We also know that stress in terms of African Americans in particular, a survey that was done and reported by the US Department of Health and Human Services in the Office of Minority Health. And this was prior to pandemic, so it'll be interesting once the data are collected following the pandemic or at this time. But prior to the pandemic, adult Blacks reported that they were 20% more likely to report serious psychological distress than adult whites. Adult Blacks living below the poverty were 2 to 3 times more likely to report serious psychological distress than those living above poverty. And adult Blacks were more likely to have feelings of sadness, hopelessness, and worthlessness than white counterparts. And this was prior. Next slide, please. Next slide, the other way. I'm sorry. Okay, so oh, I'm sorry, go back up one. I'm messing myself up because I'm trying to go along. Yeah, okay. I had it a split screen, but it went off. Okay, so this again just shows in terms of race and ethnicity by gender. So the percentage of population with serious psychological distress among adults 18 ages of older, non-Hispanic Black men were more likely non-Hispanic white men were more likely to report psychological distress. However, when we look at white women and white and Black women, we see similarities. So there's a 1.0, there's not really a difference. Actually, we see a 1 point difference or 1 point percentage difference. Let me see, sorry. Point time more likely to among white women. I know I just stumbled that all up. I'm rushing through this, looking at time. But when you look at the statistical significance of the data, and I added the link here so that you can go and look at, it's not a statistically significant difference. And that's what I wanted to get at. So the point is that stress, when we look across the race and ethnic groups in the aggregate, Blacks are more likely to report higher levels of stress, which was that previous survey finding. But when you look at psychological distress reported broken down by race and gender, you don't find a difference, a statistically significant difference in who's reporting. And so part of what I assert is life is hard as an adult, right? Or can be hard as an adult. And even though African Americans are dealing with a whole lot of traumatic stressors, which is a question that is not asked. So psychological distress compared to traumatic stressors, is where we find the difference. Are you understanding that? And if I mess that up and have to repeat it, please drop it in the notes. I'm so sorry, I'm speeding through this. Next slide. My windows side by side went away, so I can't see. I'm only seeing, okay. So how does stress affect health and what is the correlation? So the correlation here is we know that stress can affect our mental, it's not only a mental health condition, but it can also affect our nervous system, right? It can affect our musculoskeletal system, right? It can affect our respiratory system and cardiovascular system. What again is the leading cause of death in the United States? Anybody remember what that was? You can drop it in the chat. Cardiovascular disease or heart disease. Stress can affect our endocrine system and gastrointestinal system. So across the board, as well as reproductive system, stress has a negative impact on our body and our health. And when you compound that, as I mentioned before, not like in the previous slide with just mere psychological distress, but also when you compound that with traumatic stress, seeing a child killed that looks like yours, seeing a family being evicted that could be yours, right? When you compound that or add to that traumatic experiences is where we began to see, next slide, differences. So there is a, and I think I mentioned this about the multiple stressors, compounded effect. I really want to get to, and that's just saying this again. So while every person has some level of psychosocial stress, some segments of the population are at greater risk of exposure to stressors that exacerbate the psychological stress, right? So where there was similar effects in that, remember the table, Black men, white, non-Hispanic Black, non-Hispanic white, men, and not seeing a statistically significant difference. Where the difference comes in are the compounded traumatic stressors. So again, because I've done this presentation and I've had white women, for example, come up and say, well, you know, we're under quite a bit amount of stress. And absolutely, absolutely, absolutely. The difference I want to lean in on are these compounding effects of these traumatic stressors that are compounded, that are more likely to affect or impact or be the lived experience of Black women. So go to the next slide. And this is what I want to highlight. Wait a minute. Did I send you to the next one? Yes, great. Okay. So the weather, so what I'm getting at is something that an amazing researcher came out with this, and I even heard President Biden reference it, or maybe even Vice President Harris. So a lot of people got hip to this weathering effect. And it was discovered by a researcher, Geronimus, who was looking at actually the effect on maternal health. So her research initially started out with maternal health. But the weathering hypothesis has been pulled in and examined, looking at other chronic health conditions and disease. So Geronimus' concept, this weathering concept, it's not so much the presence. Everybody, yes, we're all stressed out. This pandemic has stressed all of us out, right? It's not so much the presence of stress or the presence of brief periods of stress exposure, but it's the accumulation of multiple chronic stressors, and I add traumatic stressors, repeatedly over time that have a deteriorating effect on our health. It has a weathering effect on our health. So one example, in the study, Geronimus and her colleagues, Hickens, Keene, and Bound did back in 2006, studying health deterioration and age patterns of allostatic load scores. And basically, allostatic load scores look at the psychological or physiological burden imposed by chronic and repeated exposure of stress, right? And it's indicated, oftentimes it's studied looking at cortisol and epinephrine. And so that's a whole academic thing, but it also looks at elevated systolic and diastolic blood pressures, cholesterol levels, and glycated hemoglobin, if people are interested in how do you measure and test this allostatic load. So what they found, and it's a marker for stress, right? So what they found is that in their study that Black women had higher allostatic load scores. And I know this might not mean anything to the lay person, but this is a way to measure stress effect, right? So Black women had a higher allostatic load score than Black men and white women across age groups ranging from 18 to 64. But the highest difference was, or the greatest disparity or difference was through adulthood between the ages of 35 and 64. What's going on then? You got bills, you got mortgages, right? You got children that really need a lot of stuff, right? You've got, aging issues and other health issues, right? So this should not come as a surprise. But Black women, this compounding effect, were found to have higher allostatic load scores than Black men and white women in this particular study. And then also the study analysis found non-poor Black women ages 55 and 64 had 5 times the odds of having a high allostatic load score compared to white women. What does this mean? It's not just a poverty thing. It's not just a poverty thing. You will look, for example, if you look at maternal mortality and infant mortality among Blacks, you will find it's high across the socioeconomic status. So high income earners and wealth among Black women of high wealth and income, they have high also levels of risk of maternal mortality and infant mortality. And studies have found that one of the explanations is high levels of stress as related or as was found by the work that Geronimus Hicken, Keene, and Bound, and so many others. I even used their work in my, along with McEwen and Siemens' work in my dissertation research that looked at the effects of stress on hypertension management as a risk factor for cardiovascular disease among Black women across the socioeconomic strata. Next slide, please. Okay, and so where do we go from here? So where we go from here is we've got to support, protect, and invest in women, and in particularly in women's health. In women's health, invest resources in mental health and substance use treatment and services. We've got to destigmatize mental health and substance use conditions and disorders. Oftentimes when you're stressed, that triggers other types of behaviors. And what we found, in particularly in during the pandemic, an increase in suicides, an increase in alcohol and substance use, an increase in reported depression and anxiety. And so we cannot ignore those, right? We can't go on business as usual and ignore what is happening. It broke my heart when Miss USA jumped off of that high rise I know it broke everybody's heart, but in New York, right? We cannot ignore the suicide, the increase in suicide. And while I was on the DHHS side, we saw just a disturbing increase in young people being admitted to EDs in psychosis, experiencing the psychosis, or in psychological distress, having a mental health crisis. So we've got to demand as women that that's where we want our money to go. We got to destigmatize it, request culturally and linguistically appropriate services that are also trauma informed. Because remember, I'm not saying that all women across race and ethnic groups don't have psychological distress. As we saw, right? You do, we all do. It's the traumatic psychological distress that is disproportionately experienced by Black women, as well as high allostatic loads. That is a physiological marker. We can measure and look at stress in the body. We know how it affects. We can look at stress in the body and its impact. So investing in services, healthcare services, and we've got to ask the right policy questions. So I know the League of Women Voters has forums and is one of the organizations that hold elected officials accountable to women's issues, right? We got to ask the right policy questions. I'm not saying potholes in your community isn't an issue, but if you live in a high wealth area and you got a pothole, stop putting pressure on the members to fix the pothole when they have not gone over into Southeast Durham or Southwest Raleigh or wherever, and Southeast Raleigh, and they never had the pothole fixed. We got to look at equity, right? We got to ask the right, you may have, like I have, you may live in a neighborhood where you're not worried about access. You got, not only do you have a Harris Teeter, but you've got a Walmart and a Trader Joe's with like 5 minutes from each other, right? Not only do you have sidewalks, but you also are close to the turmeric tobacco walking trail. Not only can you sit out in your beautiful yard and talk to your neighbors, you don't have to worry about the crime that has happened, or a few kids breaking maybe into some cars at night or whatever, right? So we got to start thinking about our policy questions from the perspective of equity. Yeah, I know, but it's hard for us to give up our comfort and our luxury. But are we asking the right policy questions that are going to change the needle and make things better? So for others who don't have, remember those forms of capital, who don't have the right social capital, economic capital, or political capital, right? Address the long-term and contemporary effects of racism, not as something linked to the past, but something that is affecting and that is enduring and persistent. Next slide as I close. And where else do we go from here? We also, again, this goes back to what I was getting at. We must build a healthcare, an education, a legal and economic system or systems that leave no one behind. Isabel Wilkerson's book, Caste, proposes that for most social and economic indicators in America, it shows us that America is not necessarily a democracy, but might very well be more of a caste system, with Blacks positioned at the bottom. And I leave with this picture about leaving no one behind. This is a picture of Janelle Guzman, who was the last person pulled alive from the rubble of the World Trade Center. And I think about this as evident of those who are last, those who shoulder a disproportionate burden of health outcomes, mortality, and morbidity, and who are often last or left behind. Black women, Hispanic and Latino women, and American Indian. Next slide is just a resource for you all, which is our Hope for NC helpline, 1-855-587-3463. Next slide, I am done, and we'll turn it back over. I do have a contact slide, which is the next one, but I want to thank you all for your time.
Thank you. I think we have all been changed by this presentation from Dr. Laws, and I want to thank her profusely because I understand much better about the connection between health and stress and race. I didn't even know I had an allostatic load, but I know that now, and you better believe I'm going to be reading more about that. And so I also want to close with something that Retta asked us to think about, and that was, how can the League of Women Voters, how can you as individuals make a difference? The one thing I thought about was, on the individual level, start having some crucial conversations with diverse women. Go to somebody who's not like you exactly, so you think, and tell them that you heard this presentation and have a conversation about what it meant to you and what might some of these things mean to them. Read. Dr. Laws gave us some very good books and information that we can follow up on, where for example, you can read about historical trauma. You can read about an experience from the perspective of an African American female physician who passed away. And if you really want to go deep into it, like me, you can read more about allostatic loads and stress and how you measure stress. And then once you do that, examine your mindset and see if it changed a little bit. See if what you've learned changed how you think about other people, think about other communities, because what you think matters. What you say matters, because that influences what you do. Now, at the community level, I would encourage you to expand your social networks. Number one, attend events outside of your community and your comfort zone. Now, and I'm not saying any of you have said this, but I have heard multiple times, well, I'm not going to anything in Southeast Raleigh because it's dangerous over there. Well, I would encourage you to go to events in Southeast Raleigh. There's one coming up on April the 30th at the historic John Chavis Park and Community Center. You can Google John Chavis Park and Community Center. It is a destination location in the state and the nation, and it's in Southeast Raleigh. So I would encourage you to delve out of your comfort zone a little bit and go into some communities where you might not feel as comfortable, and just be in the moment. Don't go with any intention, just be there to learn and observe and be with people. And then be the link to connect communities that traditionally are not connected. I've seen some churches do this where they adopt a sister church of another denomination or race. So think about how you can do that. And then Dr. Laws gave us several examples of how you can make a difference politically. For example, with Medicaid expansion and looking at how candidates are taking positions either for or against that. Look at paid family leave and ask the right questions of your potential candidates. So with that, I think we will close and see if we could have our post poll put up again.
And Regina, I'd like to say I did drop the links to two of the sources for Dr. Moore's story. One, Amy Goodman did a really good piece on Democracy Now! And then the New York Times ran a good piece. And then CNN, like I said, it went viral and there were a lot, but I dropped two at the request.
Thank you, Dr. Laws. Now
The
let's see
poll.
about our poll. Yay, look at this. We'll give folks a few more seconds to respond. Well, now, aren't we a lot smarter after a 1-hour presentation? So this is to attest to the value of the League of Women Voters and what we can do in terms of educating ourselves and others about topics that are most relevant to women. So now most people feel like they know enough to talk about the topic and they're very comfortable discussing the topic. Thank you for taking that poll.
Okay, and thank
now
you.
I will turn this back over to Retta. Thank you.
Thank you both so much for an informative and very powerful presentation. It certainly touched my heart very deeply. It covered so many issues, and everyone feel free to put your videos back on. We're now going to move to questions, starting with some that appeared in the chat and some that were sent to me privately. But let me just start with some of the overall comments that I received. One said, "This is an incredible presentation, such a lot of important information pulled together in a concise way." Another private message that was sent to me was, "I'm fascinated by the speakers and the type of work they are doing. I stumbled across epigenetics a few years ago and have a therapist friend who is very focused on that. I'm just in awe here. This is a powerful message." Another private message, "This is a very moving presentation." Another comment in the chat, "Thanks for the work you both do to make this reality visible, and thank you for being here today." Another private chat, "Learned new things concerning compounding effect of stressors and allostatic load scores." Never heard that one before. Important that you were talking about policy changes being critical. And one other comment that I definitely love this one. "Even with all these stressors, Black women still find time to vote." And they certainly do. I love that comment. Another comment, "Body interprets stress as danger and activates the fight or flight response." And I think that that's pretty much what you were saying, Michelle. That's absolutely true. Another comment was that this presentation and your information dovetails with the North Carolina Commission for Women and Youth Involvement recently published report on poverty, and the link is in the chat. For those of you who wanted to see the video of Dr. Moore, Dr. Laws did place the link in the chat. This is the doctor, and I was certainly stunned that she, even as a physician, was still not getting PAR care. And I think it was demonstrating to me the inequities of healthcare delivery, even for a physician. And that to me was a very powerful moment. I had known about PTSD, but never had considered ongoing stress disorder. Again, very powerful. With that, can we be glad to open the conversation up to anybody who would like to ask questions or give comments? Either raise your hand electronically or just unmute and ask your questions or comments.
I'll make a comment real quickly. I really, Regina, your comment about when we have conversations to make sure that we are redirecting that conversation to racial equity, especially with candidates and during in candidate forums or just conversations with our friends. You know, a lot of times that was a great statement that you made about, you know, we all have the Harris Teeter here, we're close to a Trader Joe's, but what about other communities, and making sure that, I think a lot of times just making our friends and others aware that those discrepancies exist, and just keep on restating that over, because as we know, it takes many times for something to stick. So just making that part of our conversation. So thank you for that.
Thanks, Cheryl.
You're welcome.
A chat just appeared. I think of complex PTSD as trauma early and often, harder to treat, but good results are always possible if we keep working on ourselves.
So I have a question for Dr. Laws. Based on that, is this accumulated stress that is from multiple places and that is repeated over time, is that treatable or mediatable?
So absolutely. Yes, right. So one is to understand what it is and what the triggers of those are, right? Some people, for example, if there's a cumulative compounding, that if it ain't one thing, it's another, if it's daily ongoing, sometimes it's hard really to zero in on what is triggering a response or the way that you are responding. A good example are when we think about kids, when we think about young people, it is treatable. It's treatable by therapy. It's treatable by, sometimes medication, right? For pharmacological response, depending on where you are. But I want to give the example. A child goes to school, they're always acting out. Child gets labeled a troublemaker, problematic, maybe perhaps even oppositional defiance disorder. Nobody thinks to ask, or nobody zeroes in or is able to really pinpoint, why is this child acting out? This is a real case that comes to mind. A teacher talked about, wrote an op-ed about a child in the Chatham County School. The mother called me and said, I need a lawyer. I don't know why people think I'm a lawyer. Everywhere I go, people think I'm a lawyer. They're just like, I need you to represent me. And I'm like, I'm not a lawyer. There were things that had been going on at home and with the mom, and the child was embodying, was taking this on. The mom, and I won't go too far into it because it is a case. So the point I'm making is, you might see the way it's manifesting, but what we always have to do, and that's the trauma-informed treatment and care, we always have to go to the root. And we say that, but we don't go there. It's hard to go there. So yes, it's treatable. Understand that it's not treatable. I wouldn't recommend that you treat the symptom, but good therapy, good treatment takes you to the root and not the symptom. And that's why some people, in the behavioral health side, don't want to start with medicine, even though say if it is just stress disorder that's affected your heart, that's affected the way you eat, which has created type 2 diabetes, which made you not feel like you wanted to go exercise, which has created obesity on top, right? So I tell people, get those things under control, but also treat whatever the underlying stressor is. So the long way of saying yes is yes, but you don't want to treat the symptom the way it's manifesting or presenting. You want to get into some good therapy to do some good deep work to treat. Another example shortly, a lady confided that she had kept to herself that her dad had sexually molested her and every single one of her sisters, and even a male cousin disclosed. And she had been in and out of our prison here and didn't disclose it. She'd been in and out for drugs, larceny, stealing. She lost her kids, just a long slot of things. And she said that she was thanking me for my advocacy for mental health and substance use, and especially among women. And she said it was much later, after she had suffered through all of those traumatic experiences that created more trauma, right? That she disclosed what the problem was. She and her siblings, and they were up in age. I mean, this woman was in her 40s. And so, so I tell people, yes, it's treatable, but please seek therapy and treatment that takes you to the root, because oftentimes the tiredness, the anger, the short-temperedness, the lethargic, the depression that comes along with it, the anxiety and so forth, are often just symptoms. They're the way the trauma is presented or the stress is presenting itself.
Thank you.
Thanks, Michelle. There were a couple more final comments that were in the chat. One was, let's expand Medicaid and stop this political posturing, which is true. And that's certainly something we are very much in favor of. And secondly, the last comment was, get this up. Unfortunately, our current medical system is primarily focused on treating the symptoms and not having either the time or the knowledge or the money resources to discover the roots of the problem. And that's just what you were referring to, Michelle. Anyway, I want to be mindful of time. Our heartfelt thanks to Ms. Pettaway and Dr. Laws for this illuminating discussion on the intersection of race, stress, and health. I know I learned a lot from the presentation, and I'd like to turn this back to Heather to take us out.
Hi, everyone. I am Heather with Timely Topics, and just want to thank not only our fantastic speakers, Retta for her help, but all of you for attending today and having such great comments. Thank you all, and we look forward to seeing you all soon at one of the many events we have going on at the League today. Thank you all.
Thank you.
Thank you.
Bye-bye.